Okay, I think we're ready to go. Again, this is Matthew Menendez and Shelley Wiggins with White Plume. Thank you for joining us this afternoon. We're going to be talking about custom scenarios today, how to use them, how to modify them, how to change them, where some places are that you might not be thinking about yet that you want to keep an eye on going forward. We're going to move quickly, but I will make sure that we leave time for questions and answers at the end. No reason to hold those till the end. Feel free to go ahead and send those in to the question panel as you have them. Just real quickly, what are our goals today? What's our agenda? What we want to accomplish here in the next 45 to 50 minutes? I'm going to start off by covering some of the most frequently asked questions that we get on custom scenarios. So we've looked at the support calls for the past 3 weeks, seen some patterns, some things that we might be able to help you with. If you haven't seen this yet, you might see some of these issues, some of these questions in the near future, so maybe we can do some preventative maintenance there as well. We're going to spend a little bit of time talking about unspecified codes because that's an area that may not necessarily be impacting you yet. Many clients still have not had claims adjudicated back yet. We're still waiting to hear from the payers on that. Everybody knows what Medicare said about unspecified codes over the summer, that they're not going to deny any claims just because of unspecified codes for the first 12 months. That leads some people down a bad road. I was talking to one physician who, when he heard that news, he said, "Oh, that's great. We'll just send unspecified codes for everything until they start denying our claims." And I think that is a logical conclusion, but it's probably not a good strategy. Unspecified codes exist in ICD-9. They exist in ICD-10, but they have some risks associated with that in ICD-10. So we're going to talk about that and how you can identify where the unspecified codes that you're using might be, and how to build some custom scenarios to head off some of those problems. We'll share some examples of what we've seen other clients do, because you do have a lot of power and flexibility in how you build custom scenarios. Not everyone's going to do that the same way. And if you need help with that, White Plume can help offload some of that work for you as well. As I mentioned before, we will leave time for questions and answers at the end. So feel free to send those in as you get them, as you have them. Shelley will probably be able to answer some of them for you on the fly. And if there are any that are helpful for everyone, we'll share those and answer those for everybody as well. So let's start off with those most frequently asked questions regarding custom scenarios. Let me walk through what some of those are, because you may have had some of these questions. You may have heard this from some of your internal users. The first one is, I'm getting a custom scenario, a pop-up, that only has one choice in it. And sometimes you see them automatically convert, and sometimes you see it pop up and still have the custom scenario, but it only has one choice in it. Why is that? And maybe more importantly, how do I fix that? We'll go through and explain that. Another question that we get often is, my practice uses dummy codes or non-standard ICD-9 codes. Can I build a custom scenario off of that code? The answer is absolutely yes. I'll show you how to do that as well. Another question that we get frequently is, how do I select multiple codes? I see my pop-up, but as soon as I make a selection, it closes the window automatically before I can select the other code that I need. How do I do that? Why does it work that way? We'll explain that, show you how to work around that in the scenario where you need to select multiple codes. Another one that we get often is, I've got a large custom scenario that I need to build. How do I build a custom scenario with that drop-down menu at the top, right? Many of you have probably seen that, particularly on fractures, on injuries, things like that. Is oftentimes where you see that. But how do I use that drop-down menu at the top as another way of organizing my custom scenario? We'll walk through those as well. Those are the big four that we've seen. So if you have questions on one of those in particular, we're about to address that. So let's start with the first one. Why am I only getting one choice in a pop-up? Right? That's the problem. I get a pop-up with one choice in it. And many people say, hey, if you've only got one choice, why are you showing it to me? Why don't you just select it automatically? I'll give you an example, and I'm going to try to use examples from a lot of different specialties as we go today, just to spread the wealth around on that a little bit. But here's an example for hypertension, 401.9. One code in ICD-9, it's one code in ICD-10. This is one of the codes that most people know. I-10 is the code for hypertension in ICD-10. Why do I see that? Well, you've got to get under the guts and understand how the conversion analysis works. There are some codes that can be translated directly from ICD-9 to ICD-10. That means it's an equivalent code in ICD-9 and ICD-10. It is the exact same thing. In those cases, by default, we do not show you a pop-up. It automatically selects the ICD-10 code without any extra user step. But there are some codes that are not exact matches. They're approximate matches. It means they're very, very close, but it's not identical. Now, most of our clients say, yes, I understand that distinction, but I still don't want my user to have to select it. And there are two ways to fix that. If you want to fix that across the board, forever and always, I never want to see an ICD-10 pop-up box that only has one choice in it. You can do that. It's through EPAS config. I'll show you where that setting is so that you can make that change. If you want to be a bit more fine-tuned in how you manage that, maybe there are some times that you want that pop-up to show with just one choice in it. You can do that on a code-by-code basis through a custom scenario setting. And I'll show you how that works. It's in the approximation setting. It's one of the things you'll see at the top of the custom scenario editor. If you have that approximation box checked, the user will get the pop-up with the one choice. If you do not have it checked, whatever codes are in that custom scenario will be automatically populated. And I want to make that distinction because you can have multiple codes selected automatically as well. I'll show you an example of that also. So if you want to turn this off always, you never want to see this type of pop-up, you can go into EPAS configuration, and you'll see this is what it looks like. You'll see code configuration on the left-hand side. Highlight that. And then on the right-hand side, the last choice down there, if you check that box, you will never see an ICD-10 pop-up with just one code in it. That works across the board for every user, for every code. Most of our clients are going that route. All right, but let me show you the other route if you do want to be a bit more precise in how you're handling that and doing it on a code-by-code basis. You can pull up that code 401.9 in the custom scenario editor. And if you see up at the top where I have it circled in red, it has that approximation box checked. That means when you click on 401.9, you will see the pop-up with that choice in it. If you were to uncheck that box, what you'll see is you'll never see that pop up again for that particular code. So if you have users that are saying, sometimes I'm seeing a pop-up with just one choice, sometimes it's converting it automatically, that's the difference between an equivalent code and an approximate code. If you want to fix that problem across the board, you can use the EPAS configuration setting. If you want to fix it for an individual code, you can go and uncheck that box in the custom scenario editor. So two ways to fix that problem depending on what your goal is. Now, the next question was about dummy codes. I'm going to use that in combination with this approximation setting to show you something that was kind of neat that, that one of our clients came up with. What they have on their form is a dummy code. They use dummy code Honda for patients that are, that are hypertensive, that are obese, that are non-compliant, that are diabetic and atherosclerotic. They use an acronym Honda for that. A lot of their chronically sick patients. And they have multiple codes that are built into that. If you want to do that in ICD-10, you can do that as well. Build in a custom scenario like this that's going to pull in all 4 of these ICD-10 codes. And you'll note that it will do that automatically because I don't have the approximation box checked. It's not going to show me a pop-up with the 4 choices. It's going to automatically pull in all 4 of those codes. Let me show you how that works. The snippet that you see in the top left is out of Capture on the Diagnosis tab. When the user clicks on that, you'll see that it highlights it in green. It puts in the first code, but it also uses that plus symbol. That lets the user know multiple ICD-10 codes are behind that. The reason they don't all display here is because we don't want to have to shift that entire form down to show all 4 of those codes. If the user hovers over that with their mouse or with their stylus, they will see all 4 codes in the tooltip. But you'll also see all 4 codes listed on the rank and link tab or on the diagnosis block. If you have that on another tab on your form, you'll see all 4 codes, all 4 descriptions here. And you may be asking yourself the question, well, that's great, it pulls in those 4 codes automatically, but what happens if you have a particular patient encounter where that patient's not obese? Well, again, you can use the delete button there to wipe out just that 1 code. Again, clients are using this to try to minimize the number of clicks for their physicians, to trying to make ICD-10 as fast as possible, to tailor Capture and their custom scenarios to their individual needs, to make it easy for the doctor and make sure that the billing team gets the right data that they need the very first time. So we've looked at 2 things so far. Number 1 is the difference between equivalent and approximate. How do I make sure that I don't see a pop-up with just 1 choice in it? And number 2, how do I use dummy codes? Can I use a dummy ICD-9 code? You can use whatever diagnosis code you use on that form. You can build a corresponding custom scenario to that, but you do need to make sure that those match up. The code on the form has to match up with the code in custom scenario in order to get that particular custom scenario. All right, so we looked at equivalence versus approximate. We looked at dummy codes. What about selecting multiple codes within a custom scenario? We typically see this 2 ways that we get the question. The first is, I need to select multiple codes, but before I can do that, the custom scenario closes automatically. Let me show you an example of this, knee pain. All right, I've got to be more specific in ICD-10. Left knee versus right knee. But there's the other problem that a lot of people bring up on this one is, what if I've got pain in both knees? Why is there not an ICD-10 code for bilateral knee pain? There's no valid ICD-10 code for bilateral knee pain. You can look it up in the book. The code does not exist. If you have a patient with bilateral knee pain, you will have to use both of those codes, right? And that's the situation that is presented here. By default, this custom scenario only requires 1 ICD-10 code. And most of the time, you probably will only use 1 of these codes. That's why the custom scenario closes automatically, so that your doctors, so that your users do not have to click close after every single encounter, after every single code. In the event where you do have multiple codes, that's where you're going to have to use this solution. And what you do is, look in the top left-hand corner. You're going to click on that pen in the top left-hand corner. And what that does is that says, don't close this window automatically. Let me select multiple codes. Don't close it automatically for me so that I can select the appropriate codes. In this case, 1 for left, 1 for right. Now when I'm finished, I will use the X in the top right-hand corner to close the custom scenario. All right? You may do this if you have, other times when you've got multiple choices and you need to use multiple codes. It will allow you to do more than 2 codes. You can select as many as you want after you've used that pen to select the appropriate codes before you hit the X. All right? So a lot of people have been asking, how do I do that? Wanted to make sure that we walked through that here today. right? Approximate versus equivalent, we've looked at that. We've looked at dummy codes. We've looked at the selecting multiple codes within a custom scenario using the pin. The next question was really on stacked scenarios. How do I use the drop-down box to give me some more flexibility in how we manage our custom scenarios? All right, let me use an example. This is probably in the top 10 codes across our client base that they use on their form today, and it's rheumatoid arthritis. Got to be much more specific in ICD-10. If you go into the custom editor for this particular code, 714.0, you'll see it's a big custom scenario that we've built. And one of the things that you'll notice, if you look up at the top, there's a checkbox for stacked scenarios. That is unchecked. All right? And when that is unchecked and you have multiple scenarios, you'll see them side by side like this. This particular example has 8 different scenarios. Right? You're only required to use one code from one of those scenarios before this window will close automatically. Okay? That's how it is by default. If you want to reorganize those 8 scenarios and make them stacked, that's what we call that when you see the drop down at the top, all you have to do is come back into the custom scenario editor, check that one box for stacked scenarios, and when you do, you'll see the new scenario look like this. And the way that you get to this is by clicking on Preview down at the bottom of the custom scenario editor screen. When you click on Preview, you'll see what that looks like. And the drop down that you see up at the very top of this custom scenario will be in the order that you have them in your custom scenario editor. So if you wanted rheumatoid polyneuropathy with rheumatoid arthritis to be at the top, you can use the blue arrow to move that up in the order. That's what will show up by default if you do it that way. It has the exact same data in it. We'll look at them side by side just so you can see. It has the exact same data, the exact same codes. It's organized the same way. The only difference is in the presentation. Unstacked, which you see on the left, will show you all scenarios at once. Some people like that because it's fewer clicks. They can see all of it at one time in one view before they make their selection, and they like it that way. Other people prefer the stack that you see on the right. It'll use the drop down up at the top to differentiate between those scenarios. And you can do that. You want to handle rheumatoid arthritis this way, and you want to handle the encounters that have episode of care the stacked scenario way. You can make that determination on a code by code basis. All right? So we've talked about approximate versus equivalent, how to make sure you don't see a pop-up with just one choice in it. We've talked about how to build custom scenarios based off of dummy codes. That allows you a lot of flexibility in how you handle this. We've talked about how to select multiple codes in a single scenario without the window closing automatically on you. We've talked about the difference between stacked and unstacked scenarios when you have multiple scenarios that you're dealing with. Those are the most commonly asked questions that we've had in the first 3 weeks about custom scenarios. And we'll continue to see these. There's a lot of flexibility and control that you have here, and we're happy to help you with some of that work if you need it. But let me spend a little bit of time talking about what I think we'll start to hear more about as we get deeper and deeper into ICD-10. Right? Everybody knows unspecified codes exist in ICD-9, and they exist in ICD-10. Now, in ICD-9, they were relatively harmless. Unspecified codes would save you room on your super bill. You may have used them that way forever. They were payable diagnoses for the most part. The problem in ICD-10 is unspecified codes are not without risk. There are short-term risks to using the unspecified codes, and there are long-term risks to using the unspecified codes as well. The short-term risk is think about why we're moving to ICD-10 in the first place. Why did the payers spend millions of dollars rewriting their adjudication algorithms? Why do they lobby Congress to continue moving forward with ICD-10? It's because they want the more detailed diagnosis codes. They want the more granular diagnosis information on their insured patient population. And if they don't get that data, if the provider community does not give that to them, they're going to start denying claims. Maybe not today, maybe not next month. It may not be for another 12 months for certain payers, but that will eventually happen. And it's probably not going to all happen on the same timetable. Medicare has said that they're not going to do that for the first 12 months, but we're still waiting to see how Blue Cross and United and everybody else is going to do that. So that's the concern. That's the problem in the short term. The long-term risk is that eventually we're transitioning away from our fee-for-service model and moving towards an outcomes-based, a performance-based reimbursement model, right? In that world, to maximize, to maintain your reimbursement, you need to use the more specific ICD-10 codes, right? We don't want to use unspecified knee pain. We want to be more specific to show how sick our patients are. So that you can show how excellent the care your providers are delivering and maintain your reimbursement. So even if this is not causing you a problem today, it's something that you should be looking for on the horizon. I would recommend trying to start off with the right way of handling this rather than waiting till it's a problem and being reactive. I think this is a situation where you have more time to deal with this now before it's a problem so that you can prevent it from happening rather than dealing with it when you start to get claims denied from certain payers. Let me show you a couple of examples of what that looks like. A common one that we see our orthopedic clients use is 71596. They use that for osteoarthritis or osteoporosis of the knee. And when you look at that on your conversion analysis, when you click on it in Excelicapture, it translates directly to M17.9. And that's because it's an unspecified code in ICD-9. There are more specific choices in ICD-9, but many of you are not using those, and so you're only getting the unspecified choice in ICD-10. And you'll notice, if you look at this carefully, it's unspecified as far as the type of osteoarthritis. It's also unspecified as far as which knee are we talking about. Again, M17.9 may get you paid today. It may get you paid in January, but eventually it's going to cause a problem. And it's certainly going to cause a problem in the outcomes-based reimbursement world. So what are your options? How can you handle that today? Let me walk through 3 options. I'll show you what they look like. The first is to leave it as it is. Leave 715.96 on your form. No change required there. And you can leave the custom scenario as it is today using that M17.9 unspecified ICD-10 code. It's an option, but I would not recommend it. Option number 2 is I'm going to replace that unspecified code on my form with the more specific ICD-9 options. 71516 for primary osteoarthritis of the knee, 71526 for secondary osteoarthritis of the knee, and you'll see the custom scenarios that go along with those codes are more specific. They have the options for left, right, or bilateral. They have the options for primary or post-traumatic or other secondary osteoarthritis. Now, the downside to that solution is it requires a forms change. It's going to take up more space on your form. and may disrupt the muscle memory of your providers. But there is a third option. I think this is the best way to handle a lot of these unspecified codes, is to leave the 71596 on your form today. Don't make a change to your form, but you can make a change to the custom scenario to include those more specific choices. And if you notice in this particular example, obviously we took off the choices for unspecified laterality. Again, that's a configuration setting. Most of our clients have chosen not to show their providers, their end users, those unspecified laterality choices, and I agree with that as well. If you had a face-to-face encounter with the patient, we should know which knee we're talking about here. Let's look at another example more in the primary care world, congestive heart failure. All right, there are many ICD-10 codes related to CHF. Many people just use 428.9 as a catch-all. The problem with congestive heart failure is that, again, it translates to one code in ICD-10, and again, that's an unspecified code. It's unspecified as far as the type of heart failure. Is it systolic? Is it diastolic? Is it combined? It's also unspecified as far as the onset. Was it acute? Was it chronic? Is it acute on chronic? Right? These are the areas where I need to be more specific in ICD-10. So again, I have my same three options here. I want to walk through this another example just so you can start to see the pattern, so you can try to identify and correct these in your own practice. I can leave 428.9 on my encounter form and let it map to that unspecified ICD-10 code. Again, I would not recommend that. I could replace the 428.9 with the more specific choices in ICD-10. So I'd take one code off and put 12 codes on my form. Now again, that's going to change your form. It's going to change the layout. It's going to change the doctor's muscle memory. Okay? And we're talking about just this as one example. You may have 10, 15, 20 examples like this on any given electronic form. That's why we like option number 3, which is leave your encounter form as it is today, but modify the custom scenario to something that looks like this. Something that shows you all of the choices. Now again, coding is part art, part science. There may be places where reasonable people can disagree as far as what you want listed, how you want it listed, how you want it organized. You've got flexibility and control within the custom scenario editor of how you want to do that. But this gives you the least change for your providers, but also gives you the best likelihood of getting the most specific ICD-10 code the very first time. Make that easy for your doctors and correct for your revenue cycle. Each of you will have different examples within your particular practice of what unspecified codes you're using, which ones you need to make changes to. If you need help with that, let Shelley know. Use the questions panel to let her know. I'll put her contact information up at the end of the webinar as well. Let her know we can get you in touch with somebody to either help you with some custom scenario consulting. If you have some of these that you want us to build for you, we can build some of these for you to save you the time. Maybe easier for you to have our team do that instead of your team doing that. But unspecified codes are something that you need to pay attention to, you need to look for, and you want to start correcting while you have time. You don't have to do all of those in the next 30 days. Okay? Unless you're starting to see those denials from your payers, you've got some time. But you want to get out ahead of this. You don't want to be next September when Medicare and everybody else is going to be denying for unspecified codes, trying to make these changes at the last minute while you're also trying to change provider behavior to not use those types of unspecified codes. Let me share with you 2 more examples that I want to show you, and then we'll try to answer some of the questions that came in that are appropriate for everybody. The next one is about add-on codes. Sometimes you need multiple codes in ICD-10, or because of the presence of one code, you also need to code the manifestation code, for example. So let me show you what one client did. Some of our OBGYN clients have done this. You know, one of the things that they do day in, day out is supervision of pregnancy. This particular code is supervision for normal first pregnancy, right? What every couple hopes for. The issue is in ICD-10, you've got to be more specific. You can't just use one code like this anymore. So if you have V22.0 on your encounter form and you click on it, the custom scenario is going to look something like this. And you can see it has choices for first trimester, second trimester, third trimester. Now the concern is that there's also a code for unspecified trimester. Another example of an unspecified code we probably shouldn't be using. But there's also this new concept in ICD-10 where you have to be more specific about the weekly gestation code. Which week of the pregnancy are we in? Not just the trimester, but what week are we in? So let me show you one way that we've seen clients try to address this. V22.0 supervision of normal first pregnancy, what they've done is created a custom scenario that looks like this. And the good news is, from a solution perspective, it removes the choice for unspecified trimester, but it also, down at the bottom, adds the weekly gestation codes. Now you'll notice this is just one scenario, okay? It's one scenario that actually has multiple choice lists, meaning one code is required from each list. You've got to choose one of the first 3 codes, and then you also have to choose one of the latter 40 codes. Now, the concern here for some people is all of it's right, it has all of the right codes, it's organized well, but it's a very long custom scenario, right? Because of all of the different codes, all of the different granularity that you have here. It's very long. So what we're going to do is try to look at some of the ideas, some of the solutions that we've seen today already, and how you might incorporate that to make this example more user-friendly. So let me show you what we've done here. Same code, but what we're going to do is we're going to use multiple scenarios to try to make that an easier solution for the end user. You can see they've organized it by trimester, first, second, third trimester, but it also shows you the gestation codes that correspond. So for the first trimester, it has the choices for less than 8, and then 8 through 12. For the second trimester, it has weeks 13 through 27. And then for the third trimester, it has weeks 28 through 42, and then above 42, right? What no new mother wants to endure. But there is a code for that in ICD-10. Right? That's the one way that you could do that, right? And that's an unstacked version. If I wanted to use that stack checkbox on this particular custom scenario, it would look something like this, where you make the selection of the trimester at the top, and then it shows you those particular choices at the bottom. So a neat solution of how they handled that when you've got a scenario that requires more than one code, and combining that with the stacked scenario or multiple scenario layout. Again, the point that I want to drive home is you've got a lot of flexibility, you've got a lot of power in the custom scenario editor that allows you to creatively solve problems for your practice. And if you need help, if you need a little bit of extra hand-holding on that, let us know, and we can get you in touch with the right person to get you help with that. Let me show you one more example. This one's really interesting, at least in my book. Orthopedic practice that had a same code listed in 3 different sections. The way that they organize their encounter form today is by joint, right? And you can see that they've got the same code, 99640, in multiple sections, right? A mechanical complication of an internal device in the hip or in the knee or in the spine. Now you can, if you can zoom in, if you can read the text there, what you'll see in those 3 that are highlighted yellow is the code is the same in each of those examples, but the description is different. And if you have subspecialists in this particular group, who's a spine surgeon, they don't want to see the choices for hips or knees in their custom scenario. They only want to see, they want to keep the context of where they were on the form. How do I handle that? How do I handle that when it's the same code and custom scenarios apply all the way across my database? I've seen multi-specialty groups that have had this concern. Say my specialist wants one list of choices, but my primary care physicians for the same code want a different list of choices. How do we handle that? Right now, as it is, if they leave their form that way and they don't touch their custom scenarios, regardless of which choice they choose, their custom scenario pop-up is going to look like this. It's one code. They're still seeing the pop-up for it because it's an approximate, but it's going to be the same one for every single one of those, and it's an unspecified code. We're really combining all of the concepts that we've looked at today into this one last example. All right, so what do we do? How do we handle that? Let me show you what the solution is. The first step is create dummy codes. So you'll notice here we've still used the same code, 996.40, but we've added an extra digit to make a dummy code. 99640K, 99640H, 99640S for knee, hip, and spine. That allows me to then create custom scenarios based on the dummy code so that I can have 3 different custom scenarios. So I only include the knee choices in 99640K. Same thing for the hip and for the spine. Right? I'm going to include the more specific options. Right? Rather than redesigning my form, I can make this small change, and in the custom scenario, I can include those more specific options that I want to include here. And then I'm probably going to use the stacked scenario based on episode of care. And so what that lets me do is when I click on 99640H, the custom scenario that I see is well organized. It has my more specific choices. It doesn't include the unspecified codes that I don't want to use. It does not include the knee codes. It does not include the hip codes. Excuse me, it does not include the knee codes. It does not include the spine codes. It only shows them the hip-related codes here. And I'm not showing all of the choices for subsequent or sequela because I have those in the stacked scenario. We always recommend, if you're using episode of care, to keep the initial encounter as the first scenario. And the reason why is because the historical diagnosis section should make it easy for you to select the subsequent encounter choice or choices when that patient comes back. If you do not have the historical diagnosis section on your encounter form today, again, let Shelley know, because that's something that's very, very helpful for your clinical staff. Right, so remember, we tried to cover a lot of ground. We talked about the most frequently asked questions regarding custom scenarios, the approximate versus the equivalent. How do I not see a pop-up with just one choice? We talked about how do I create custom scenarios using dummy codes. Got a lot of flexibility, a lot of power there. We talked about how do I select multiple codes using the pen when I need to select multiple codes. We talked about how to use stacked versus unstacked custom scenarios in different situations. We talked about how to use add-on codes when you need to select not only the trimester, but you also need to include the weekly gestation. We talked about how to use a lot of those combined here to make this work for your physician workflow. You've got a lot of power with custom scenarios. Let me do one more slide here, and then we'll get to as many questions as we can. I want to make sure that we are respectful of everyone's time. But custom scenarios are already created, they're already built, they're already loaded in version 5.1.6. There are more custom scenarios on the way in version 5.1.7. One of the things that you'll see there, kind of two things that people have pointed out. Every now and then, there was one that snuck through that that only had the initial episode of care codes in it. It did not have the subsequent or sequela choices. Those are all corrected in 5.1.7. The other thing in that vein that's corrected in 5.1.7 is for historical diagnoses. If you have a historical diagnosis section that includes an ICD-10 code with an initial episode of care, the early guidance was that you would only use that initial episode of care code once. Subsequent guidance has been that as long as you are still in the active treatment phase for that particular problem, you will continue to use the initial episode of care code. So when you click on a historical diagnosis code that's an initial episode of care, the pop-up box will include the initial episode of care code again in version 5.1.7. 5.1.7 is scheduled to be released next week, so be on the lookout for that as well. As a reminder, as far as how the custom scenarios work, by default, we assume that you are using the correct ICD-9 code, meaning if you're using an unspecified code, we assume that you meant to use an unspecified code and give you the choices as such. That's a place where many people are building those custom scenarios like we talked about today. The custom scenario editor allows you for a lot of that flexibility, a lot of power in how you handle this. That can be, it's a great tool. Learn how to use it. I hope today has gone a long way to help you learn some of the tips and tricks as far as how to use that. But if you get overwhelmed or if you get intimidated and you'd like some additional training on that, we can provide you with some additional training. If you want us to just do some of the work for you, just so it can be done, we can help you with that too, right? Some people say, hey, can you teach me how to fish? Yes, we can teach you how to fish. Other people say, hey, I'd rather you catch it and clean it and put it in the refrigerator for me. We can do that either way. Just let us know what would be most helpful for you. Again, just another reminder on the unspecified codes, I would review the codes that you're using today, review your conversion analysis. If you need help identifying which ones, again, that's something else that we can help you with. So let us help you if you need it. We want to get out ahead of this. Being prepared is what made ICD-10 on October 1st go smoothly for you, and we want to make sure that that continues to happen over the next 12 months. So if you need help creating custom scenarios, identifying unspecified codes, or you just want us to build some for you, please let us know. The questions panel is a great way to do that. I'll put my contact information up here, Shelly's contact information up here, so that you have that. Reach out. You can reach out through support. You can reach out through one of us. We'll get you pointed in the right direction. Thank you again for your time this afternoon. I hope that this was helpful for you. I'm going to turn it over to Shelley, and we'll answer as many questions as we can here in the last few minutes. So thanks again for being great clients, and thanks for your time this afternoon.